Welcome to the Bay State Fat Loss informational video series. In this video, we will discuss the relationship between weight and prostate cancer. In addition to advances in disease mechanisms and molecular imaging, prostate cancer research has also provided insight into the risks and consequences associated with obesity. Cancer experts believe obesity is quickly overtaking tobacco as the leading preventable cause of cancer in the United States. Men with a BMI of 25 or higher have an increased risk of prostate cancer diagnosis, metastasis, disease recurrence after remission, and cancer-related death. There are two main types of fat contributing to this risk. Subcutaneous fat, shown here in yellow on the outermost edge of the body, and visceral fat in yellow surrounding the organs in the abdominal cavity. Fat cells constantly release dozens of molecules that disrupt the normal cellular environment through inflammation and altered immune function. The result is an environment more hospitable to cancer cells and less able to prevent one cell from growing into a tumor. After a primary tumor is established, cells that enter the bloodstream are more likely to invade other tissues, leading to cancer metastasis. Studies show that for every increase of 5 points in BMI over 20, risk of prostate cancer diagnosis rises by 20%. Men considered obese, that is, a BMI of 30 or higher, see a dramatic increase in risk of advanced or histologically aggressive prostate cancer at the time of diagnosis, a lower chance of localized disease, and a higher risk of disease-positive margins at resection. Increased risk for overweight men extends well beyond diagnosis. Prostate cancer mortality rises in proportion with BMI. The increased risk ranges from 55% to over a 3.5-fold increased risk. Metastasis is more than 3.5 times as likely in obese men, and prostate cancer recurrence after remission is almost double in men with a BMI of 25 and higher. All evidence points to a strong link between weight and prostate cancer, and almost every aspect of the disease is affected in a negative way as a result. The level of effect that being overweight has on prostate cancer is on par with genetic and hereditary risks. Luckily, unlike genetics, weight is modifiable. You can do something about the increased risk of prostate cancer due to weight issues. Studies show lowering BMI and visceral fat changes the game dramatically. Losing just 11 or more pounds lowers your risk of prostate cancer diagnosis by 20%, and losing 20 or more pounds reduces the risk of metastasis by 42%, and prostate cancer-related death by 35%. Don't wait until you become a statistic. Change the game, transform your body, and reshape your future with the Bay State Fat Loss 40 Days program. Lose at least 20 pounds of fat and lower your BMI, target visceral fat, reduce overall body fat percentage. It's time to go beyond regular diets because weight gain and weight loss are complex issues and there is no one-size-fits-all solution. At Bay State Fat Loss, we use cutting-edge science and technology to identify and target the molecular basis of your weight gain. We have the tools, we have the knowledge, and we have the experience to help you change the game, transform your body, and reshape your future. At Bay State Fat Loss, our program is all about you, because you are worth it. To schedule your free initial consultation, call 508-663-8105 or click the Make Appointment button here on our website.